You mentioned of the value of being in a holistic context and how that's been rewarding to you as a practitioner. And this is very interesting because I'd be curious to see when you do cognitive behavioral therapy in isolation, where you know for a fact that this person is doing everything else in their life identical to how they were doing it before, which led to their depression. And now the only thing that they're doing is cognitive behavioral therapy. They haven't changed their diet. They haven't included or changed anything when it came to exercise, their hydration, their exposure to spiritual things. They haven't done any of these things. What do you find is their results in comparison to those that do these other holistic areas of health?
Well, I've never been involved with research in the outpatient setting, but it is discouraging, especially now being involved with Dr. Nedley's residential program. It is discouraging to know that you can't control some of those aspects, or at least you can't force people to. I mean, you can educate them, but it's really on them whether or not they're going to be, enhancing their frontal lobe with those lifestyle changes that they would make. So, you do your best with the CBT piece while knowing it may not have the same effect, or at least the speed of it, the speed of recovery won't have the same implications.
I could imagine. I could imagine because they're not aiding their mind. And so, for example, if somebody's vitamin D level is is the vitamin D level of a corpse, which can happen. People can have their vitamin D level that low. They could do all the therapy in the world and they will still not feel happy because their body was designed to feel happy when it has the supply it needs.
Right. Well, and when you talk with participants who have gone through the program, most all of them talk about coming here and experiencing this fog, that they feel they're in this fog and they can't quite get out of it. But then maybe by day 5 or 7, this fog starts lifting and CBT concepts are starting to make sense to them. And then at that point, we really are able to see major changes in the therapy room. We don't have to point things out as much to them about their distortions. They're calling themselves out when they're experiencing a distortion and some of their core misbeliefs.
Do you notice the difference? Can you tangibly see the difference?
I can see a difference, yeah. And then of course they confirm that. They express that, I'm feeling a lot better. This is making sense. It's still challenging, and I think that's why some clinicians struggle with CBT, because it takes work. And there are other treatment modalities out there that seem to have a quicker fix. But I think there's beauty in challenging ourselves and really working hard at something. And because nobody's immune to even being trained in CBT, nobody's immune to distorted thoughts and those core beliefs that can really creep up on you in moments where you might feel a little insecure about something that's going on in your life or